So if you're calling us specifically to look at airway and sleep, we bring you in on our doctor side instead of going through hygiene first. But basically, when you come in, we're going to go through different sets of questions. If you're a kid, we typically use the PSQ, the Pediatric Sleep Questionnaire, which has really high sensitivity for determining airway and sleep disorder breathing issues. And their studies show that it is very sensitive, even compared to a true sleep study. So by asking these series of questions, you could potentially determine if your kid has a airway or sleep disorder breathing problem versus sending them directly to a sleep study, which may be hard to get, pretty expensive, maybe a little scary for the kid, and may not look at all aspects of sleep and growth and development. So if it's a kid, we're going to ask those questions. If it's an adult, we use like the Epworth sleepiness scale. We have other questions that we ask to just determine the what kind of symptoms from their own experiences, what they're seeing. From there, we dive into just different areas. Again, if it's a kid, we typically send home with a sleep image ring. It gives us a good snapshot of what potentially is going on at nighttime. It's not a true sleep study, but it's very easy, a low barrier for us to figure out, to see what potentially is going on. It's just a little ring that they wear at nighttime for 1 or 2 nights. And it gives us an idea of what the heart rate's doing, what their pulse ox is doing, what how their respirations are going, and then how much activity is going on at nighttime, how much the ring is moving and their body is moving while they sleep. It also gives us a snapshot of some sleep architecture signs and see what's going on there. From there, we will get full diagnostics of a CBCT, looking at a 3-dimensional rendering of their skull, looking at their growth and development based on where they should be in all 3 planes of space. We get a digital scan of their teeth, and then for kids and adults that feel like they can't breathe through the nose, we're going to do rhinomanometry on them, which is a simple 2-3 minute test, non-invasive, just looking at the pressure versus flow from their nose, and see how well their nose is functioning. So basically, rhinomanometry will look at how much resistance is going on in their nose and the flow rate based on that. And if they have high resistance in the nose, the brain may force them into more mouth breathing at that point. Our subjective data, our clinical findings, our CBCT, all that we combine together to come up with a very detailed plan or recommendation for the kid or teen. That may include referrals to ENT, looking at nasal congestion, deviated septum, turbinate hypertrophy, adenoids, tonsils, things like that. It can maybe a referral to myofunctional therapy. It may be a referral to a sleep physician, or it may be looking at growth and development from a dental perspective and seeing if we can do some expansion or interceptive treatment to change the pattern of growth for that kid.